bad. "I don't think it's going to be germline," says George Church, a Harvard geneticist often sought out for his prognostications. "The 8 billion of us who are alive kind of constitute the marketplace." For several years, Church has been circulating what he calls "my famous or infamous table of enhancements." It's a tally of gene variants that lend people superpowers, including APP and another that leads to extra hard bones, which was found in a family that complained of not being able to stay afloat in swimming pools. The table is infamous because some believe Church's inclusion of the HIV-protective CCR5 variant inspired Hu's effort to edit it into the CRISPR babies. Church believes novel gene treatments for very serious diseases, once proven, will start leading the way toward enhancements and improvements to people already born. "You'd constantly be tweaking and getting feedback," he says, something that's hard to do with the germline since humans take so long to grow up. Changes to adult bodies would not be passed down, but Church thinks they could easily count as a form of heredity. He notes that railroads, eyeglasses, cell phones, and the knowledge of how to make and use all these technologies are already all transmitted between generations. "We're clearly inheriting even things that are inorganic," he says. The biotechnology industry is already finding ways to emulate the effects of rare beneficial variants. A new category of heart drugs, for instance, mimics the effect of a rare variation in a gene called PCSK9 that helps maintain cholesterol levels. The variation, initially discovered in a few people in the US and Zimbabwe, blocks the gene's activity and gives them ultra-low cholesterol levels for life. The drugs, taken every few weeks or months, work by blocking the PCSK9 protein. One biotech company, though, has started trying to edit the DNA of people's liver cells, the site of cholesterol metabolism, to introduce the same effect permanently. For now, gene editing of adult bodies is still challenging and is held back by the difficulty of delivering the CRISPR instructions to thousands or even billions of cells, often using viruses to carry the payloads. Organs like the brain and muscles are hard to access, and the treatments can be ordeals. Fatalities in studies aren't unheard of, but biotech companies are pouring dollars into new, sleeker ways to deliver CRISPR to hard-to-reach places. Some are designing special viruses that can home in on specific types of cells. Others are adopting nanoparticles similar to those used in the COVID-19 vaccines, with the idea of introducing editors easily and cheaply via a shot in the arm. At the Innovative Genomics Institute, a center established by Doudna in Berkeley, California, researchers anticipate that as delivery improves, they will be able to create a kind of CRISPR conveyor belt that, with a few clicks of a mouse, allows doctors to design gene-editing treatments for any serious inherited condition that afflicts children, including immune deficiencies so uncommon that no company will take them on. This is the trend in my field. We can capitalize on human genetics quite quickly, and the scope of the editable human will rapidly expand, says Urnov, who works at the Institute. We know that already today, and forget 2124, this is in 2024, we can build enough CRISPR for the entire planet. I really think that this idea of gene editing in a syringe will grow, and as it does, we're going to start to face very clearly the question of how we equitably distribute these resources. For now, gene editing interventions are so complex and costly that only people in wealthy countries are receiving them. The first such therapy to get FDA approval, a treatment for sickle cell disease, is priced at over $2 million and requires a lengthy hospital stay. Because it's so difficult to administer, it's not yet being offered in most of Africa, even though that is where sickle cell disease is most common. Such disparities are now propelling efforts to greatly simplify gene editing, including a project jointly paid for by the Gates Foundation and the National Institutes of Health that aims to design shot in the arm, CRISPR, potentially making cures scalable and accessible to all. A gene editor built along the lines of the COVID-19 vaccine might cost only $1,000. The Gates Foundation sees the technology as a way to widely cure both sickle cell and HIV, an unmet need in Africa, it says. To do that, the foundation is considering introducing into people's bone marrow the exact HIV